It's very important to maintain a healthy weight throughout life for a multitude of reasons. One of the most important is that the more overweight you are, the higher risk you are for certain types of medical problems, including diabetes, high blood pressure, high cholesterol, and those things are also risk factors for heart disease, so increase your risk for heart attack and similar problems. Those are kind of the big scary things, but there's other things to worry about as well. People that are overweight put more stress on their joints, their hips, their knees, their back, and have an increased risk for arthritis as they get older. Certain types of cancers are going to be more common in people that are obese or overweight. So there's a long list of medical things that we worry about in people that are overweight. Also, the younger you are when you start to try and get into these healthy habits, the easier it will be to maintain them as you get older. Trying to work on healthy diet, getting regular exercise, and incorporating that into your daily routine is an important thing to do, and the earlier the better, but it's never too late to start. I think there's a couple very specific diet and exercise steps people can take to start losing weight. I think first and foremost, you need to make a commitment to doing it. So, you need to make sure that you're gonna work on your diet. You need to make sure you're gonna make time for exercise, because without doing those things, it's probably not gonna happen. There's not, some magic diet, some magic pill you can take that it's gonna happen without you having to work at it. So you have to kind of make that commitment and be serious about it. I think diet-wise, you really need to sit down and think about what you're going to do with your diet in order to lose weight. It's in the world we live in is very fast-paced. It's much easier to eat those donuts in the break room for breakfast or go through the drive-through for lunch, and not the healthiest choices in those places. So whether you join a program that helps you become structured in your diet, whether you buy a book that helps you count calories, whether you just sit down and say, I'm going to cut back on my carbohydrate intake, there's a multitude of things you can do, but you need to pick something and start with it. The other thing I think that's really important is you need to make time for exercise. I think once again, we live in a busy world. For most of us, exercise is probably the lowest on our list of priorities when we have a million things to do during the day. But to really be effective in weight loss, you're going to have to get some exercise, and to maintain weight loss, you're going to have to make time for exercise. I think realistically, people can expect to see results fairly quickly if they are committed, once again, to modifying their diet and exercising. I think a good goal for most people is probably a pound or two a week, which doesn't sound like very much and probably doesn't make people very motivated sometimes, but I think that's a realistic goal. I think that, certainly you're gonna have times when you have slip-ups and there's things that happen, the holiday party at work or whatever, that kind of makes you take a step back. But I think for the most part, a pound or two a week is a reasonable goal. I think in terms of exercise, you really need to start slow, because if you try and go 2 hours a day every day and your body's not used to that, it's not going to happen. You're going to feel more fatigued, you're going to feel more tired, and that's not going to be what you want. So I usually tell patients start with 10 or 20 minutes a day, if that's all you can do, and work up from there. Make sure you're breaking a sweat, getting your heart rate going, and I think that is a reasonable place to start. Once you do that and you're going well with that, definitely try and increase the time that you do it, and you probably notice you feel more energy, you feel better, and that'll be more motivating for you to continue to follow your program and to maintain your weight loss. I think people should learn to let go of the scale a little bit when they're trying to lose weight. Initially, you may not notice the numbers going down, especially in the fashion that you want it to be. But I think things that you're going to notice first: your clothes fit better, you have a little bit more energy, you sleep a little bit better. There's a host of things that you do every day that might be easier as you start to lose weight. So I usually tell patients, don't get on the scale every day. Don't obsess over, I lost a half a pound, I lost 1 pound. Maybe weigh in every 2 weeks or every month, but try and maintain that healthy lifestyle, and you will notice the numbers go down. Shawnee Mission has a variety of resources available to help patients with weight loss. I think first and foremost, it's important to make an appointment with your regular physician, your primary care doctor, to go over your plan for weight loss. We can talk about diet, we can talk about exercise, what's reasonable for you, and what's a good goal for your weight loss. We can also get some baseline lab work, look at your cholesterol, your blood sugar, things like that, that we're going to want to monitor during the time that you're losing weight. We also have a group of dietitians that are available for consult. They can go over with you the appropriate amount of calories you should be getting in a day, how to break down your diet in terms of carbohydrates, protein, fats, and things like that. So they are certainly a good resource for us. They also put on a series of classes, I think twice a year, and those are excellent to try and get some tips and tricks for losing weight and kind of a get started type of thing. So that's also a nice program that's available to our patients. I'm Jennifer Schultz, and I'm a primary care physician with Shawnee Mission Primary Care.